Hello, everyone. Today I wanted to talk about mallet finger, which is also known as baseball finger. And this is an avulsion of the tendon. It can either happen in any finger or the thumb. The main distinctive feature of mallet finger during physical examination is the inability to extend the finger. In this case, I'm showing you a radiograph with an avulsion fracture in the distal phalanx. And so you can see here that's the avulsion fraction. That's actually where the tendon attaches. So in terms of mallet finger, you can have really two types. You can have the extensor tendon rupture without the presence of a fracture, or you can have, like in this case, the avulsion fracture. Thing I wanted to add is the importance of having multiple views in an X-ray and particularly an MSK examination. Here you have an 8P view of the patient with mallet finger, and it's relatively hard to identify where the injury is. However, we can use the soft tissues, and here you can see we have a little bit of more soft tissue swelling, and that already draws our attention to that and gives us an idea of what's going on. Then we move on, we have the oblique view, and we start seeing some changes here, maybe some soft tissue swelling, but really it's not very clear what's going on until we get a lateral view of the region of interest in which we have the avulsion injury more readily identified. In terms of treatment, it should be noted that most mallet finger injuries are not treated surgically, but they should be treated with non-surgical management. The non-surgical treatment is relatively strict, and it will require a short splint, as the one I'm showing right now, for 8 weeks. It should really be worn full time in order to achieve the best results. There's also a specific procedure in which you can change the splint, but you have to be careful to maintain your finger during extension at all times so that you get a good result. There are some cases in which you have a major fracture fragment or some subluxation. In that case, the surgical treatment might be considered. When deciding about surgical treatment, an orthopedic surgeon with that specializes in treatment of hand injuries should be the physician that's consulted in order to determine whether there's a need for a pin, a percutaneous pin, often called a K-pin, in reference to the individual that invented the procedure that carries its name. These are the ones that are used in order to immobilize this again for 8 weeks.